Your brief now. How are plans shaping up for people being able to attend live events in the summer?
Well, look, we've set out a really ambitious roadmap, which we're working very hard to deliver on. So if all goes well and vaccine remains on track as it is and we keep the disease under control, by the 17th of May, we'll be back to the sort of things that we saw last summer. So socially distanced performances, indoor and outdoor. And then the big step forward will be on the 21st of June, which will be the point at which we want to get as much back as we possibly can. And I'm working really intensively to work on the safest way to do that. So I've already announced pilots. For example, we're going to pilot at the FA Cup final. We're going to pilot at the Crucible. We're looking at how we can ensure in indoor and outdoor settings, how we can get as many people back as we possibly can and get back to the things we really love as a nation.
You're quoted in the papers today as saying that your confident fans can pour into Wembley with less or no social distancing for the Euros, and that's because of COVID certification. What exactly will be COVID certificates and what will that entail?
Well, from the 21st of June, if all goes to plan in the way that I described, we hope to get people back in significant numbers. We're piloting the different things that will enable that to happen. Clearly, it will have to be done in a COVID secure way. So you would expect, and we'll be testing these things like one-way systems, things like masks, things like hand hygiene and everything else. And as part of that, another thing that we are considering is a COVID certification, and we'll be testing whether we can use COVID certification to help facilitate the return of sports. Obviously, final decisions have not been taken on that, and I'm working with the Chancellor of Duchy of Lancaster, Michael Gove, who is leading on our COVID certification work programme. But I think that is a potential tool that could help the return of the things that we love.
But what exactly will a COVID certificate be, and how will that differ from a vaccine passport, say? I mean, people will want to know the minutiae of what a certificate will mean.
Yeah, and we are working through those details, and we've already said that we've got a review. That review is ongoing, and we'll publish the review. We've been clear that there won't be a vaccine passport. The Prime Minister has made that very clear. What we have said, though, is that in order to prove, for example, that you've had a vaccine or that you've had a successful negative test, we're looking at ways to help facilitate proving that. And that may be one of the things that could help ensure that we can get more people back into stadiums. But remember, there's three tracks going on here at the same time. One, and the most important thing of all, is that we continue to control this disease. So that means everyone abiding by the rules, it's working, getting numbers down, and the taking their vaccine when they get the call up to do so. We're making good progress on that. Secondly, the Chancellor of the Duchy of Lancaster and others I'm helping alongside this is looking at different mitigations that we could use, including the COVID vaccine certification. And I'm also through
how would somebody go about getting a COVID certificate? How long would it last? And how would you police that they have actually gone through the right process to get the certificate?
Yeah, and look, those are all entirely legitimate questions, which is exactly why we have set up this review, and we're working through the challenges to get that right. And what we said is that can potentially be a tool that will enable people to return. But remember, it will sit alongside other things to make places safe, like one-way systems, like hand sanitizing. And all of this is all predicated on getting the vaccine rollout delivered and getting the disease under control, because it's only if we do those things that we can even start considering the kind of large numbers of people returning that we so desperately want from the 21st of June, in which I'm making my number one mission. I've been meeting several times this week. That's why we've got Nick Heitner, very famous theatre producer, David Ross, working with many people to see how we can get people back safely in large numbers. Because if we don't manage to do it, this summer, if we succeed with the vaccine rollout, if we succeed in getting the disease under control, I'm really worried about the future of those industries that are so vital, not just to our sense of national well-being, but to the whole national economy.
And do you envisage that there still will be social distancing? You're saying that you want to get the maximum people back into stadia, but will there be social distancing?
Well, I hope we will be able to find ways of mitigating against certainly having the sort of social distancing that we have at the moment, because the sort of social distancing we have at the moment makes it very, very difficult, for example, for theatre productions to be run profitably. It makes it very, very difficult for our football clubs to run profitably if you have to have those large distances between people. Now, clearly, we've been in a situation for the past year where we've had to have those distances. So we are proceeding with caution. That's why it's the last stage. That's why we are piloting different ways of mitigating against that. And as we've discussed, one of the things that we are considering as part of that is COVID certification.
And can you guarantee once open, football stadia and the like will be able to remain open? We have heard from the scientists that when it comes to the winter months, we might have to start wearing masks again and then by implication social distancing again.
Well, that's why we are proceeding with caution, because we really want these to be a permanent reopenings. And one of the things that I know that frustrated people last year was not being able to have that sort of certainty. Obviously, as you and your viewers will appreciate, this terrible disease has changed over time, but we'll be doing everything we can to ensure that it's permanent. I'm sure you'll appreciate that we can't foresee every last eventuality, but what we are doing is trying to get the conditions right so this will be a permanent reopening.
I wonder what you make of the University of Warwick's modelling study that's out today, in which they say it's vaccinating all adults in the UK is unlikely to achieve herd immunity and fully contain the virus.
Well, first of all, vaccination has a huge beneficial impact. It has a huge beneficial impact for the people taking it. It's the best way to stop you getting the disease. And once you've had 2 doses, it is highly effective. And certainly if we, as we get through the top 9 categories, and we're confident we'll do that by mid-April, we should see enormous reductions in hospitalizations and deaths.
But can you comment specifically on their line that it won't fully contain the virus?
Well, the evidence is emerging on the effect of the vaccine on spread. So we don't know fully the picture. I think it will have a significant effect on spread, but no vaccine is going to be perfect. Of course not. You're not going to, by vaccine alone, fully prevent the spread of the disease. But the sort of steps that we have outlined have in mind that we sufficiently reduce hospitalizations, reduce deaths, so that we can live with this disease over the coming years. So there won't be an elimination of the disease, but we should get to a point where it is safe for most activities to resume. And that is what the roadmap is all about.
And on the vaccines, on the shortage, can you clarify exactly what the situation is with the lack of vaccines that are coming from India?
Well, I think the Prime Minister and the Chief Medical Officer and Health Secretary addressed this yesterday. There has been a delay in respect of about 5 million doses from the Serum Institute in India. They are doing a fantastic job and working as hard as they can. We always knew there were going to be fluctuations in the vaccine, but we are confident on those landmarks to reopening that we are on the right track. So we got the most at-risk people vaccinated by the middle of February. By the middle of April, we want to get all over 50s and the most vulnerable vaccinated. We're confident we're on course for that. Once we've done that, we really will have a huge impact on reducing deaths and hospitalizations. And then by the end of July, we're still on track for getting the rest of the adult population vaccinated. So you would expect movements up and down a bit, but the overall trajectory, we're very much on course with that.